You can have endometriosis, be told that everything looks normal, and still struggle to get pregnant for years. I'm going to show you exactly how it's missed and how to actually investigate it. Endometriosis is a leading cause to many women's fertility struggles, and it is so commonly missed. I'm Dr. Cindy. My husband, Dr. Cody, and I are the doctors behind Fertility for Two. We help couples get pregnant naturally. A lot of women are told that everything looks normal, their labs are fine, their imaging is clear, and ovulation is happening. But they're dealing with symptoms like painful periods, pain with intercourse, or digestive issues. And the reason that this gets missed is simple. Most of the standard testing that's done in fertility workup is not designed to detect endometriosis. So, if you've been told that everything looks normal, that does not rule this out. Endometriosis is a condition where tissue similar to the lining of the uterus grows outside of the uterus. This can be on the ovaries, the fallopian tubes, the bowel, or any internal structure. The bigger issue isn't just the physical lesions, though. It's the environment that those lesions create. All that means is that it reduces your chances of getting pregnant because endometriosis can impact egg quality, fertilization, and implantation. So, even if ovulation is happening, even if sperm parameters look decent, the environment itself may not support pregnancy. Let's break this down clearly. There's no single perfect test, but there are levels of investigation. First is symptom pattern recognition. This is where it should start, but often it doesn't. We're looking at patterns like painful periods, especially if it's worsening over time, pain with intercourse, chronic pelvic pain, digestive symptoms around the cycle, infertility, or recurrent miscarriages. This doesn't diagnose endometriosis, but it raises suspicion. I've worked with many women who were diagnosed with endometriosis but do not have painful periods or pelvic pain at all. So the absence of these symptoms does not rule it out. We'll talk about a client of mine who falls in this category in a little bit. A second way to investigate is with ultrasound. A standard pelvic ultrasound can sometimes detect ovarian endometriomas, which are cysts associated with endometriosis. But it will miss most superficial or mild cases. You can also get an MRI, which is more sensitive than an ultrasound, and that can detect advanced forms of endometriosis that have invaded the surrounding organs, or larger endometriosis lesions. But even an MRI can miss smaller or early stage disease. So normal ultrasound or MRI does not rule out endometriosis. The third way to investigate endometriosis is through blood markers like CA-125, but this is not specific. It can be elevated for multiple reasons like fibroids, liver disease, and some types of cancer. So it's not a reliable diagnostic tool on its own. Some markers associated with inflammation don't necessarily mean that the uterus is not receptive. So testing alone doesn't always give you a clear answer. The fourth and gold standard for diagnosing endometriosis is laparoscopy. This is the only way to definitively diagnose endometriosis. Now, it does require exploratory surgery, and the good news is, if the surgeon finds a lesion, they can often remove it during the same procedure. The surgery allows for direct confirmation of endometriosis, staging of the disease, and treatment at the same time. But here's the trade-off. It's invasive and it requires anesthesia, and not everybody needs to jump straight into surgery, which is the case for Ashley, a client of mine. Ashley and her husband Max had been trying for 16 months. They had 2 losses, both around 6 weeks. She was diagnosed with unexplained infertility because everything looked normal and her basic labs were within range. Her tubes were not blocked, her cycles were regular and not painful. Max's basic semen analysis was normal. Now, if you've watched any of our videos, you know that we don't accept unexplained infertility as a diagnosis. After extensive blood work, including a CA-125 and other inflammatory markers for Ashley, we concluded that endometriosis or chronic endometriitis were both possible culprits of her fertility struggles. Ashley took this to her fertility specialist and requested a uterine biopsy to test for CD138, as well as do a receptiva diagnosis. In her case, chronic endometriosis was ruled out, but she tested positive on the receptiva DX, which suggests possible endometriosis. Now, there are a lot of different treatment avenues to take once you reach this diagnosis, but in Ashley's specific case, we focused on decreasing inflammation, improving metabolic health, and supporting hormone signaling to ensure that she develops quality eggs and grows a uterine lining that is receptive of implantation. As for her husband, Max, we discovered that his sperm had high DNA fragmentation, which may have been contributing to poor embryo development and early loss. My husband, Dr. Cody, has a video on DNA fragmentation that I'll link in the description below. So, what should you actually do with this information? If you suspect endometriosis, the goal is not just to prove that it exists. The goal is also to understand how your current environment is being affected. Because like I said earlier, treatment depends on how advanced the endometriosis is, and that's not always reflected by symptoms alone. Jumping straight to surgery without addressing the environment misses a major part of the problem. You can still reduce inflammation, improve metabolic health, support immune balance, and optimize the reproductive environment before ever going into surgery. This is where a structured investigation matters, because when someone comes in with unexplained infertility or symptoms that suggest endometriosis, we're not just asking, is it there or not? We're asking, what's the inflammatory load? What's the metabolic state? How is the immune system behaving? What is the quality of the reproductive environment? That's how you move forward with clarity. This is not something that you need to guess your way through. So if you're trying to conceive and you suspect something is being missed, you don't need to keep guessing. We help couples identify and address the root causes of infertility. Let us support you through your fertility struggles. You can apply to work with us through the link below. From our family to yours, have a fertile day.